Hello, everyone. My name is Dr. Gabriel Corral. Today, we're going to do a quick review on how you can support your loved one through a vaginoplasty recovery. This comprehensive guide is for family members and caregivers providing support during transgender vaginoplasty recovery. Your compassionate care makes all the difference, and this is very important during this healing process. Let's take a look. What is your role as a caregiver? Supporting a loved one through vaginoplasty recovery is both an honor and a significant responsibility. You are providing essential physical and emotional support during a crucial time in their life. This surgery is life-changing and requires dedicated aftercare for optimal healing. Your presence, patience, and understanding contribute directly to their recovery success and overall well-being. What is a vaginoplasty? A vaginoplasty is a gender-affirming surgery that creates a new vagina using existing tissue. This complex procedure requires precision and expertise from specialized surgeons. The recovery timeline is usually 12 weeks, with a full recovery expecting to be completed around the 1 year mark. Each person's journey is quite unique and different and may vary from these timeframes. Care requirements. There is an enormous amount of protocols that should be followed after surgery. Strict adherence to them is quite important. This includes wound care, pelvic therapy, dilation medications, and some activity restrictions during the early recovery phases. How can you best support your loved one and prepare your home environment? Bedroom setup. Create an easy access to the bathroom and keep all necessary supplies within arm's reach. Consider a bedside table with medications, water, comfort items, and ensure the bed height allows comfortable entry and exit. Bathroom safety. Install grab bars near the toilet and shower if needed. Ensure adequate lighting and remove any slippery rugs or obstacles. Remember, douching in the bath is advised, not standing or in the toilet. Medical supplies. You will need several of them. Stock gauze, lubrication, wash, antimicrobial solution, which can be purchased through Amazon, hydrogel with silver, pads, medical tape. You will be given prescribed medications. Don't forget to include stool softeners, 1,000 milligrams of vitamin C, and a multivitamin. And also have a thermometer. Keep supplies organized and easily accessible. Have a backup supplies on hand to avoid any last-minute pharmacy runs. There's also a couple of comfort items you should consider. Gather extra pillows for positioning, ice bags, heating pads, loose comfortable clothing. Consider soft blankets, entertainment options, any personal comfort items your loved one would prefer. There's also an emotional preparation that should take place before surgery. Before surgery, engage in an open discussion about the expectations and concerns. It is normal to feel anxious and concerned, especially right before surgery. Recovery in both physical and emotional challenges and preparing mentally is just as important as a physical preparation. Understand that mood changes may occur due to pain medication, and the nature of healing process. Your patient understanding and consistent support will provide stability during this vulnerable time. Validate feelings while maintaining optimism about the recovery journey ahead. What to expect immediately after surgery between days 1 and 7. The first week after surgery requires the most intensive care. Your loved one will experience significant discomfort and will need assistance with daily basic activities. The majority of discomfort happens on the right side of the abdomen. In many cases, there's very minimal pain in the genitalia until dilation takes place. This is completely normal and expected. Don't overstep the nursing care or propose increasing pain medication. Discuss your concerns to the surgical team when they see your loved one. Focus on pain management, mobility assistance, and following all medical instructions precisely. If you have the opportunity to review the instructions, do so. Your calm, reassurance, presence during this critical period helps create the foundation for successful healing. Pain management protocol. They will be given administered medications, prescribed pain medication exactly on the schedule. If the patient seems comfortable, then we will hold on any narcotics and try to use analgesics. Staying ahead of pain is easier than catching up once it intensifies. Always rely more on Tylenol or ibuprofen and use narcotics only at night for dilation if needed. You can monitor the pain levels. Use a 1 to 10 pain scale to clearly communicate with your loved one. You can track discomfort levels throughout the day. Document patterns and communicate any significant changes to the medical team. Applying ice therapy is ideal. There will be a considerable amount of swelling right after surgery, and the swelling will stay for several weeks. The swelling can create the labia to look asymmetric, one side fuller than the other, and this is very expected. Use ice packs as directed to reduce any swelling. You can always wrap the ice in cloth to prevent any skin damage from the ice. Comfortable positioning. Help arrange pillows to support comfortable positioning that doesn't put pressure on any surgical site. A comfort pillow or a donut pillow will be important after surgery for sitting. 2 pillows between the legs after dilation is started to rest the legs is quite comfortable. Small position adjustments can increase significantly comfort levels after surgery. You will also need to help your loved one with mobility and movement. A gentle assist. We expect that patients are able to gently, slowly move out of bed, but some of them may require gentle assistance. Support careful movements in and out of the bed using proper body mechanics. You can protect you and your loved one from any injury. You can move slowly and let them set the pace. Provide steady assistance during bathroom visits, respecting privacy while ensuring safety. Encourage gentle walking as approved by the surgeon to prevent any blood clots to promote healing. Gentle walking means you can go around the kitchen area or in the living room for a few laps during the day after your recovery, but try to avoid going outside or taking a mild walk. This is a slow diagram showing you how you can go from a laying position or supine position by bending your knees, rolling to the side, slide your feet over the edge, and push up with the elbow and the hands to get yourself propelled from the bed and sitting up. Wound care and hygiene. You want to make sure that you follow instructions. There will be specific protocols on how to clean and dressing of the surgical site. It is always safe to clean the area with soap and water and a soapy gauze, followed by hydrogel with silver. This is the majority of the wound care that will take place on the incisions for the first 3 months of surgery. Try to avoid deviating from instructions. Try to avoid using other supplementations such as bio oil, which are not indicated in the acute healing phase. Maintain a sterile technique. Wash hands thoroughly, use sterile gloves and sterile supplies. You want to try to avoid contaminating the surgical site. Monitor for any signs of infection. Although drainage, specifically white yellowish drainage, is quite common, you want to avoid for any specific areas of fever, unusual discharge coming from a red spot, or any areas of separation. This type of signs require immediate attention that may require antibiotic prophylaxis. You can assist with cleaning, although we expect your loved one to do it by themselves, especially with the dilation, but assisting with packing or using a moist gauze after everything has been cleansed can be really helpful. You can help with gentle cleaning, always moving from the cleanest to the least clean area, and only use approved cleaning solutions such as Vash antibiotic solution or soapy water as well to clean the surgical site. Understanding dilation. This is really the most critical aspect of the recovery. Dilation is absolutely essential for maintaining a good surgical result in a patient vaginal canal, and it requires a lifelong commitment. This process prevents the newly created vaginal canal from narrowing or closing, which would require additional surgery to correct. You can see on the picture on the top, these are the sole source dilators. Your loved one usually will start on the purple or blue and incrementally increase to the green, and finally the largest orange, which is not shown on the picture. On the picture at the bottom, there's the Milli dilator, which is a dilator that can expand. This can be an adjunct to help with dilation, as it can be introduced and then can be slowly increased in size inside the vaginal canal. But this is a very short dilator, which is helpful for opening of the vaginal introitus, but you should continue to use in the sole source dilators. Your role includes ensuring the privacy of the patient, providing emotional support, and help maintaining the prescribed schedule. It is easy to forget because dilating 3 times a day can be quite busy. Never pressure or shame, instead offer understanding and practical solutions when challenges arise with adherence. Some patients prefer more of the dilation later in the day or even at night, and this will be okay as long as the 3 times a day is accomplished by the end of the 24 hours. How can you best support the dilation success? You want to make sure that you create a comfortable and private environment where your loved one can complete dilation without interruption or self-consciousness. This is a very mental process where patients need to be relaxed, make sure that they have a comfortable space. Some patients refer to use music or even aromatherapy to get in the mood of dilation. You can help keep track schedule to help maintain a prescribed dilation routine with gentle reminders. Missing dilation can have serious lasting consequences with narrowing of the vaginal canal and help making sure that pelvic therapy appointment is set up starting on the third week for all types of vaginoplasty and continue on a weekly basis for 12 weeks. Emotional support, as we talked about in the past, providing this encouragement without being intrusive is key. This intimate process can be physically and emotionally challenging, especially in the early recovery. And you're there also for assistance with problem solving, help address schedule conflicts or difficulty, and offer practical solutions how to overcome those challenges. The ongoing recovery after the second and third week, there's a gradual process that begins at home. Patients are able to, at this point, take a shower. Sitz baths are only recommended for specific scenarios, so please check with us before this. Gentle cleaning, as we talked about with a wash or a soapy gauze will be important. Assistant with nutrition, trying to avoid high sugar uh, junk food or sodas. Want to make sure you're increasing your protein intake. And if you can, using 40 to 60 grams of protein powder is ideal to be started 1 month before your surgery. Activity levels will slowly increase and pain typically begins to decrease, but this can be very variable between individuals. On the week 4 and 5, there will be a little bit of a more of an increased independence. The vaginoplasty incisions are now healing a little bit better. You feel like you can walk a little bit more. You should continue providing emotional support and assistance with medical appointments and medication management. And once you pass the 6 week, the majority of the area has healed, although you still have 6 weeks more to go. Physical restrictions will continue to become less. Patients may be able to feel more comfortable driving, and make sure that you're there to celebrate progress while understanding that complete healing takes several months. Medical emergency and warning signs. Contact the surgical team if you develop any infectious signs such as fever greater than 1 or 2, or specific redness coming from a certain area or foul odor. Severe pain that increases dramatically despite pain medication. This is usually something that is expected during around the dilation time, but if you're laying in bed and have developed severe pain, it's more unusual for this to happen in the vaginal area. Severe pain can sometimes oscillate in the abdomen and can be quite uncomfortable, especially during the first few weeks after surgery, but this usually resolves over time. Heavy bleeding, bleeding that doesn't stop with gentle pressure or packing after an hour, or soaks two dressings quickly, is a sign of concern. Some spotting is perfectly normal, but heavy flow is not. Urination problem, complete inability to urinate or severe burning pain while urinating could be signs of urinary tract infection, and you want to let us know for initiation of antibiotic prophylaxis, potentially. What about communication guidelines with your loved one? Always ask before helping, respect their autonomy and dignity. You don't want to overstep. Use affirming language and chosen pronouns consistently. Be patient with recovery time and timeline variations. Maintain a strict privacy and confidentiality, and listen without judgment and validate feelings. For the medical providers, prepare questions in advance of your appointments. Advocate for the patient needs and concerns. Understand permission requirements for accessing medical information, specifically around HIPAA compliance, even if you're a parent. Keep detailed records of symptoms and progress, and communicate changes promptly and clearly. Be familiar with the patient portal, as this is the best way to communicate with us and send us pictures of your loved one progress. Emotional support strategies, active listening. Give your full attention when loved ones want to talk. Avoid trying to fix everything. Sometimes they just need to be heard and understood and need time. Validate their feelings. Acknowledge that their emotions are valid and normal. Recovery can bring unexpected emotional challenges that deserve recognition and support. And remember to celebrate each milestone. Acknowledge progress, no matter how small each day of the healing is. Each successful dilation, each step towards recovery deserves recognition. Managing medical appointments. You want to make sure you're there when it's possible, and especially around the pre-surgical preparation, it is key for you to attend the appointments that happen prior to surgery. Prepare questions. Work together to create a list of concerns, symptoms, or questions to discuss with the medical team. Take notes. Document instructions, review the patient's medications, review the videos that are prescribe for the patient to watch as well, and assist with medication management. What about long-term recovery? Well, after 6 months, things get a lot better. You're going to encourage increasing self-care and healing process while remaining available for assistance when needed. Support their return to work, activity, and relationship at their own pace. Continue celebrating recovery milestones together and understand that complete integration of surgical results into an overall well-being takes time and patience. Sensation can be quite variable. Patients may initiate penetrative intercourse, and this may not feel normal at first until patients get used to. We have a specific video about peritoneal and intestinal vaginoplastic customization and post-op care. Please check out this video. It talks about long-term implications for dilation, douching, and GYN care. Caregiver self-care, taking care of yourself. Providing intensive care is emotional and physical demanding as well for the caregivers. Taking breaks and asking for help from others to support people isn't selfish. It is necessary for sustaining quality care over time. Maintain your own social connections, activities, and stretch management practices. Consider joining a caregiver support group if available. Don't hesitate to seek professional help when you need it. Good self-care directly improves your ability to provide compassionate support. This is very important. You may rely on other services such as home care and other social groups in order to support your loved one. As a caregiver, you don't want to burn out yourself. You want to have compassionate care, and you can only do this if you have the necessary mental peace to provide it and do so. Some of the essential resources we have, of course, medical resources, but we have all the information on the recovery and for the surgery itself. We want to make sure that you understand the navigation of insurance coverage and want to make sure that you maintain your relationship with your primary care provider and the mental health provider. After surgery, it is absolutely necessary to continue seeing your mental health provider, as this can be a little bit of a roller coaster emotionally to navigate through this. There's also community support. Connect with transgender support and PFLAG organizations throughout the recovery time. And there are a number of educational materials about how to stay informed about transgender health issues and learn appropriate terminology as well, such as these videos can help you navigate and prepare better as a caregiver. Your impact makes all the difference. Supporting someone through vaginoplasty recovery requires patience, compassion, and dedication. Your care and support play a vital role in both physical healing and emotional well-being, contributing significantly to a successful recovery. Remember that recovery is a unique process that takes time. Your understanding, presence, and commitment to a respectful care and willingness to advocate for your loved one needs support their journey towards living authentically. An important reminder is when in doubt, always consult with the medical team. This guide provides general information but cannot replace professional medical advice specific to individual circumstances. Thank you for watching. I hope this is helpful for any family and caregivers helping patients navigate through surgery. If you have any questions, don't hesitate to reach out to us with the link or email below. Thank you for watching.